As I suspected. Sap.
Chocolate-induced stroke, sleeping with your eyes open, and what the heck is a fridge bod? Get ready to laugh because today we're back at it, breaking down and reacting to all of the hilarious medical scenes and absurd injuries from Family Guy number 17. Let's dive right in.
Still on those meds, huh?
Yeah, they helped me to, think.
You've heard the names of, say, Adderall or Ritalin. They're a little bit different medications, but they're a type of stimulant to help people focus.
Okay, time for an eyes open nap.
Stewie's eyes are wide open. You can see the white all the way around, say, the iris and the pupil. You get concerned actually with other medical problems relating to your thyroid, where the eyeballs might be pushing out and you actually might have hyperthyroidism.
Putting you on that stuff was a huge mistake. See, this is how American society treats unique, enthusiastic children. Instead of embracing their mental gifts, their first reaction is to shoot them up with hardcore drugs until they're mindless sheeple.
Yep, takes all kinds.
To diagnose somebody with these type of medical ailments or disorders is done at a younger age when people are very active and they have creative minds. So it's hard to really determine does somebody actually need this or not. There's specific criteria.
You know, a lot of kids in my school take ADD pills. They say if you're lazy and unmotivated, it makes you super energized and productive.
Really? Productive?
ADHD, right? We don't use ADD anymore, we use ADHD. Attention deficit hyperactivity disorder. Not something that is typically diagnosed in the emergency department, but we do see people on these medications.
Focus, huh?
Oh, geez.
Okay, well, Stewie, these babies can help the garbage disposal focus, because that's where they're going. No need to follow me, because I just said what I was going to do.
Disposal of medications, the most appropriate thing to do is actually just bring them back to the pharmacy and they can dispose of them. You got to be careful flushing them down the toilet. Depending on where you live, it may go into water supplies.
Time's almost up, Peter. We're gonna win.
No, we're not. And in a stunning turn of events, Chef Griffin is eating his entire meal.
Peter ate a ton all very quickly, having a poor diet over a long period of time, smoking, uncontrolled hypertension, diabetes. A lot of these risk factors of family history play in part to how likely you may in the future have a heart attack or stroke.
You threw the cook-off for me?
I couldn't take your dream away. Heart attack from you, buddy. You're the mini stroke with the real heart attack talent.
So every time he says he's having a heart attack, he's having chest pain, right? There's no way to actually know in that moment if you're having a heart attack. A heart attack basically is a blocked blood vessel around the heart. Typically a very small plaque that becomes like a clot real quick. Then you decrease blood flow and you get pain to that area.
You heart attack deserve the show. Regular stroke, not me.
You're a good friend, Peter.
Stroke symptoms usually are one-sided because we have two halves of our brain. Stroke hitting the left part of our brain will affect the right side of our body and vice versa. And then also the balance center of our brain, your cerebellum, has to do with like balance and dizziness.
This place is paying Meg to do what?
Nothing. When you have 1 million followers, people just pay you to hang out.
No, that doesn't happen. I have 1 million+ YouTube subscribers on the channel at the moment, and no, I do not get paid to randomly hang out. Shout out to you guys for subscribing to this channel.
Yo, yo, yo! Everything here is made with corn syrup. Just drink the corn syrup!
Please do not just drink corn syrup. High fructose corn syrup, basically what we add into a lot of things, especially here in the United States, to make things sweet for the sugar purposes. Oh my gosh. So Meg collapsed because of blood sugar being super high. Blood sugar can normally range in a normal person with a normal functioning pancreas and insulin production between 70 and 100, 110. Once things start getting higher than that, then they're concerned for diabetes.
Meg has type 2 diabetes.
Type 2 diabetes is basically you're not born with diabetes and you've put your body into such a situation where you've taxed it so much over time. Having high amounts of sugar in your body has significantly impaired your ability to manage the elevated blood sugars.
I need to draw a little more blood for the lab.
Oh my gosh. We don't actually typically put spouts into people. Obviously, we put IVs in. There are some type of devices that we'll put into people where if there's fluid in the lung,
He's got fluid.
put a chest tube in that has a valve on it. If you have too much fluid in your brain, you can actually put a shunt in where you drain fluid out and you can adjust the valve as well.
As I suspected, sap.
Typically, people will put these type of devices into a type of tree to get syrup out of them.
I want to be picked up now, Mom. Fine, I'll see you at 4. What do you want?
Oh my gosh.
I have no idea what's going on.
Allergic reaction.
I feel like I'm turning back into my old teenage self, and there's nothing I can do about it.
Lois is stressing out, a lot of anxiety, and she has a rash. So this rash could be brought on by stress and get hives. Typically, if you treat the offending problem, control the anxiety, this will go away.
I see. Did you recently run into an old bully, or were you tagged in a very unflattering Throwback Thursday photo?
Wow. In the emergency department, if somebody comes in with an allergic type reaction, we give steroids, Benadryl, Pepsid, fluids, plus or minus an EpiPen. Just depends on the extent, and we're actually just trying to get the body to stop having an overreaction.
I did. I ran into a girl who terrorized me in junior high, and she used to call me Scully Lois.
Like scoliosis. That's very good.
Oh my gosh. So she's in a type of brace that's keeping her upright, all the way down from the lower back all the way to the neck.
Look at that neck.
This could be a type of scoliosis brace. You can also use this type of brace for different types of spine or vertebral fractures to keep in alignment.
Dr. Hartman, what's happening to me?
Well, Mrs. Griffin, I think you're suffering from severe nerd damage.
Severe nerd damage.
I'm a nerd.
I guess I have that too. But no, maybe nerve damage or autoimmune type reaction due to stress.
You see, all nerds are one tossed-off joke away from reverting to their worst, most humiliating selves.
But I don't want to be a nerd forever.
Tell you what, find the coolest guy in school and give him a tug behind the bleachers. That usually solves it.
Oh my gosh, no. She also has an eye twitch on the left eye, and that could also be related to muscle spasming, stress. Just like you'd have a cramp in a leg, you can have cramp in the eyelids. There's multiple different muscles that affect that eye as well as nerves.
Does that really work?
I don't know. Why don't we go find out?
Oh my gosh, Dr. Hartman totally inappropriately hitting on his patient. There's no right scenario where a doctor should be dating a patient. Family Guy never fails, quite entertaining, and I just can't believe that there are so many medical scenes and issues that we could talk about on this. If you guys enjoyed this and you want to continue to have more medical topics discussed via all these shows, continue to watch, please, and definitely binge watch this playlist. As always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.